pandemic in this province, in this nation, and around the world is by broad-based, first of all, access to vaccines, which we have attempted to provide in Saskatchewan, and a credit to all of those hardworking Saskatchewan Health Authority members in community after community that have enabled us to do that alongside our pharmacies. And then the second is for people to actually go out and get their first dose of vaccine, ultimately their second dose of vaccine, so that they can become fully immunized and have the best chances at not only not contracting COVID, but ensuring their chances of severe outcomes when they do contract COVID are much, much lower. So, masking is not mandatory. However, in saying that, if people, feel that a mask is necessary, and we've been living with this long enough that people can make that judgment and that decision as in their daily lives, and I encourage them to carry a mask and to make that decision when they feel it's appropriate. But that is a stopgap measure. Ultimately, the measure is for us to encourage more people to go out and get vaccinated, first and second dose here in the province, and that is what some of the policy initiatives that we're putting forward here today, we believe will help us achieve here in Saskatchewan. But Dr. Shahab, anything to add to that?
Yeah, I'll just add that, we have had and are continuing to enjoy a beautiful summer. And if you're outdoors, obviously, we can enjoy the outdoors with friends and family without a mask. Many of us are in workplaces where we are with the same consistent group of people. And if everyone's comfortable, everyone is vaccinated, you can work together in an indoor space without a mask on. Large, more complex workplaces in common areas, a mask may be recommended, but not when you're with your smaller cohort group of co-workers. Same applies with, meeting friends and family. Many families and friends get together regularly, indoors or outdoors. For the most part, everyone knows that everyone's vaccinated. You stay home if you're unwell. And that's what's allowing us to, live more normally without high risk of transmission. But, if you are in a crowded indoor space like a transit bus or other setting where there's lots of people in an indoor environment who you don't know or you don't know their vaccination status, absolutely it's important to wear a mask. It's true that applies to many healthcare settings. And of course, if specific offices or workplaces or businesses request you to put a mask on, I think it's important to respect that option as well. Thank you.
Follow-up question, Kyle?
Yeah, I guess for the Premier, we've heard both yourself and the Health Minister say multiple times that the MHOs can make these recommendations. Well, now we have all the MHOs from across the province making these recommendations, but the province still isn't taking this decision when it comes to masking. I guess, is there a level where this will be reached, where a threshold will be reached, or more recommendations will be needed to implement it?
We have seen the MHOs in the local regions work, for example, most recently with their school divisions on what the public health measures would be as our kids return to school, understanding that those that are 11 and under are not yet eligible for a vaccine, and that's a place where we've asked our local medical health officers to engage with their school division to provide them with some of the data and some of potentially their recommendations regarding. And understanding that there's different vaccination rates in different areas of the province. There's different rates of COVID infection in different areas of the province, and there's different class sizes, most certainly, and different pieces of different levels of infrastructure available in various areas of the province as well. And so the medical health officers have provided their guidance and relayed their knowledge with respect to the local regional situations to our school divisions, where we have seen now some variation in the policies of school divisions that are returning to class here this week in many cases. But with respect to provincial guidelines and provincial policy that's being put forward, we work closely, yes, with the SHA and with all of our physicians, but most certainly with Dr. Shahab and his team on, what steps can we put forward that will, encourage vaccination. I encourage people to make the decision to go out and get vaccinated. And what we are seeing is, really two areas where the proof of vaccination or proof of a recent COVID test are becoming more appropriate. One is in those large venues, and we've seen our Saskatchewan Rough Riders move forward this morning universities a week or two ago. And the second place would be in that employer-employee relationship and providing that safe workplace, which you see the provincial government as a significant employer here in the province moving forward with our Tier 1 and Tier 2 front-facing healthcare workers in enacting that proof of vaccination or proof of a negative test policy in the weeks ahead. So the medical health officers have engaged at the local level most recently with their school divisions, and we respect that. At the provincial level, we'll work with Dr. Shahab and his team as we move forward.
We have Tyler Barrow with CTV.
Yeah, this is for Dr. Shahab. How dire are ICU units right now?
So I'll make some initial comments and then maybe Scott can speak further. I think from my side, what I want to say is that the vast majority of hospitalizations are preventable. And, unfortunately, we are seeing, middle-aged adults for the most part who are unvaccinated coming into hospital. Many of them require oxygen in acute care beds. Some do require ICU care. But I think the vast majority of hospitalizations right now are in middle-aged adults who remain unvaccinated, and many may be in an age range where the risk is higher than if you're very young. Many may have comorbidities. So really, it's a reminder for us that for whatever reason, if you did not step up to get vaccinated, it's never too late. There's abundant opportunities for vaccination, and I would really urge everyone to get vaccinated. And then I'll maybe ask Scott to comment on the ICU and bed capacity.
Thanks, Dr. Shahab. So today's numbers show that there's 30 patients in ICUs across the province that are COVID patients, and 116 hospitalizations overall, which are not the highest numbers we've seen, certainly through the pandemic, but they are creeping up over the last couple of weeks. Certainly with ICU, we try to maintain, as you know, a 79 bed capacity across the province and leverage the provincial organization to make sure that we don't have patients just stacking up in singular ICUs. But I will say that the vast majority of ICU patients right now are COVID related, and Saskatoon, Regina, and certainly Prince Albert, where we're seeing case jumps, are not at capacity, but they're getting to the point, particularly in Saskatoon and Regina, where we might have to activate more additional beds.
You have a follow-up, Tyler?
Yeah, the other thing I want to ask is how fearful should people be about a fourth wave setting back the province's reopening strategy, which was implemented July 11?
Well, I'll maybe a couple of words, and then Dr. Shahab, you may have a couple of words as well. As we have found our way through this pandemic for probably 19, maybe possibly 20 months now, we've learned as we went, as we have consistently kept as our guiding light the healthcare capacity that we have and the healthcare service that we can provide, not just for COVID patients, but trying to provide as many healthcare services to all of those other people in the province that require and expect to be able to access healthcare services. So our healthcare capacity has always been the driving factor behind the decision making that we have made as a government. That being said, we do need to learn to live with COVID. We have close to 70% of people in this province that have done exactly what they need to do, gone out, got their first shot, gotten their second shot. We're seeing those numbers of first dose and second dose continue to increase each and every day. Not as much as they were during the days when we had large volumes of vaccines going out, but each week we're up just over 0.5% on our first doses. Each week we're up close to 1% on our second dose, about 0.85% on our second dose. So there are more people vaccinated each and every day in this province than there were the day before, and we need to continue doing that in the weeks and months ahead. But ultimately, as we move forward, and we are in the fourth wave largely because we still have a few 100,000 people in this province that have not made the choice to get vaccinated. But if you look out through the next number of months, it's quite likely, and we're hopeful that we will see the ages of 5 to 11 be eligible for that vaccine at some point in time this calendar year. That will increase the number of people in Saskatchewan, yes, that are vaccinated. We will see more people going to get vaccinated like we have up until this point. We'll see people that may want to travel this winter that will make the decision to go out and get vaccinated. We're seeing people that are returning to the post-secondary education campuses that are, yes, going out and getting vaccinated here today. So there, you know, the measures that we are putting in place today are measures to encourage people to make that decision, which is a lasting measure. When people get vaccinated, that has a lasting impact on how we can manage and live with COVID in the months and years ahead, versus a public health measure like a masking mandate, which is a short-term measure. And when you pull the masking mandate, ultimately you're right back where you started, and COVID will pick up where it left off. And so we are transitioning. I would say that, you know, this isn't a question of whether or not it will impact our reopening here in the province. We are transitioning here in Saskatchewan to, you know, how best can we live with this virus that is present in our communities. It's present across the province, and we need to learn, you know, how to manage it as best we can, how to manage it to ensure that we can preserve the healthcare capacity that we have, but yes, how we are going to live with this virus in our communities in the time, you know, in the foreseeable future. So, Dr. Shahab, anything to add to that?
Yeah, thanks. I'd just like to add that I wouldn't say the term fearful is the right term, because what I'd like to say is that, you know, for the last 18 months, many workplaces have remained open with, you know, good COVID protocols. Now they have an additional layer of protection, that's vaccination. So many workplaces now continue to work very successfully with more staff vaccinated. Some may be instituting, as the Premier said, protocols where if you're not vaccinated, you may require regular testing. You know, many workplaces support people who are unwell to stay home for the 10 days until they recover. And of course, if you're unwell, you should always stay home and get tested. So workplaces, for the most part, are doing better. Many workplaces have people now back in the office full time, and it's working well. But I do agree that, you know, there is about 35% of the population that hasn't received 2 doses. 30% who received 1 dose have to receive the second dose. And those are the settings where there is a significant risk of transmission, especially with the Delta variant. And that's where we do see sometimes clusters of cases. We've seen them in the communities throughout Saskatchewan, especially in the far north. Unfortunately, when there's a hospitalization or death, communities do rally together and vaccination rates go up from a low of 20-30% in some cases to 80%. But why should we have to wait for an unfortunate event which results in hospitalization and death? I think this is the time, you know, fall is coming. We'll be spending more time indoors. We have a more transmissible Delta variant. And really, it's in all of our benefit for us to step forward and get vaccinated for those individuals in settings where our vaccination rates are not as high as they need to be. Thank you.
We have Phil Tank with the Star Phoenix. Go ahead and unmute yourself, Phil. Phil, can you hear us? Phil, we can see you, but we can't hear you. Okay, why don't we go to Adam Hunter and we'll come back to you, Phil, when you can figure out how to unmute your audio. Adam, are you there?
Yeah, thank you.
Go ahead.
Doesn't it appear to me that anything announced today will increase vaccine numbers? We have the second lowest vaccine rate with Alberta in the country. Many other provinces are announcing plans for either vaccine mandates or proof of negative tests for a larger segment of workers like educators, long-term care workers, and are also mandating proof of vaccine or negative test in public places, BC, Manitoba, and many of the major sporting teams in the country. why aren't we entertaining anything that will increase the number of people vaccinated if we're all in agreement here, and you're all in agreement that the vaccine is what's going to prevent the dire outcomes, and we have about, as you mentioned, 1% a week of increase in first and second doses?
Yeah, Adam, I actually disagree with the premise of your question. What we're doing here today is absolutely just that. We've said we've been working with the Saskatchewan Rough Riders for a period of time now, and we are offering to work with other organizations that are hosting large venues on if they should choose to move forward with a proof of vaccination or proof of a negative test type of environment, and I expect many of them will. That we are going to work with them on how that can become operable, and we need to remember that these policies actually have to be operable on the ground. We will work with them to provide to individuals as seamless as possible their vaccination records, so that should they choose to attend that event, they would be able ultimately to provide it. But I expect, as you look forward through the next number of months, we'll have, a number of various leagues, hockey leagues, basketball. We have a professional basketball team in this province, a professional lacrosse team. We have the WHL, the SJHL, all of these type of events, and you add on to that different concerts that would, ultimately like to be hosted in many of our urban centers here in Saskatchewan, that we're going to work very closely with them, so that when they do choose to move forward with this type of a policy, and we expect that many of them will, that we're going to work with them so that it can actually be operable, and we can have a successful event on the ground. This is to maybe one difference than some other provinces, not all, but some other provinces, is this is a very collaborative approach. We are working, alongside our organizations. Some may be municipalities, as a matter of fact, that will be hosting some of these events, but we're going to work collaboratively alongside them to support them in enacting these policies, rather than a heavy hand of government telling people exactly what will and won't happen. And we expect the success to be very similar to any success that has been implemented or enforced in other provinces. On the second piece, and the second appropriate place for a proof of vaccination or proof of negative test policy to be enacted is between the employer and the employees. And we're leading on that front here in Saskatchewan by prioritizing those front-facing healthcare workers, our Tier 1 and Tier 2 healthcare workers, the same ones that were prioritized for early vaccination eligibility. We're going to now go back into those same classifications of healthcare workers, and we're going to work and engage with the labor organizations, again in collaborative fashion, to move forward with a policy to ensure that our healthcare workers that are front-facing in our healthcare system, A, are either vaccinated and able to prove that, or B, have a very recent negative COVID test to give families the assurance that the people that are caring for their loved ones are doing so in as safe a manner as possible. So we feel this is providing leadership on both fronts. It's not implementing the heavy hand of government on its citizens, if you will, nor do I think that is the appropriate fashion for a government to act. This is a much more collaborative approach, and we feel it will have every success as the implemented approach.
Follow up, Adam?
Can any or all of you explain the disconnect between what was announced today and what the MHOs have requested the government do?
So I'll maybe just make a quick comment on the vaccination side and then on the second question. So on the vaccination side, I think we have to recognize that 70 and older, 87% 2 doses, 80 and older, 89%, 60 and older, 83%. So in the 60 and older, still 17% of people have not either completed the second dose or started their first dose. 50 to 59, age group, 81% have received the first dose, but 74 second dose. So with each decade, the vaccination rates are lower. So this is really the time to bring the vaccination rates up. Obviously, the risk of hospitalization increases with age group, but also with the Delta variant, it's higher. It's, Delta variant is more transmissible, and there's some data from the UK showing a higher risk of hospitalization, just like the Alpha variant, higher than the original strain. So again, even if, and medical health officers and SHA immunization teams have been talking to people as they go around in different parts of the province. In many cases, people still haven't gotten around to getting the first or second dose. So this is the time. In some cases, people haven't seen a lot of COVID in their community. So I think it's important as we enter the fourth wave that, COVID is picking up in many parts in the far north, Saskatoon. It will likely over time also come in South Rural and maybe even Regina, even though Regina has the highest vaccination rates in Saskatchewan. And I think, again, it is important that we shouldn't give any space to COVID and get vaccinated. In terms of medical health officers, I think we worked on, with very strict public health measures throughout till July that were in place because there were no vaccines in place. And sometimes they would become even more strict when there was a surge, as in Regina. As vaccination started picking up, we were able to reach a point where our case numbers were much lower than what they had been, less than 5 per 100,000. Our hospitalizations were trending down below, I think, 30 people in hospital. And we were able to enjoy the summer. Now, going forwards, we have to adjust as we see trends. Right now, we are seeing a surge mostly in far north and in Saskatoon. So obviously there may be a more consistent increase in mask use in crowded spaces. We hope that vaccine uptake increases. And we also know that people, for the most part, are adjusting how they behave. So many people may be making sure that they only have gatherings with vaccinated folks. Many who have underlying risk factors may opt not to go to a specific gathering where they think, they don't want to take the risk of exposure. So I think people do adjust and either with more mask use or adjusting, where they're going and is that venue going to be a place where everyone's vaccinated or not? And, I really hope that these adjustments by the majority of us will help to, reduce our increase in not just case numbers, but hospitalizations. But obviously, this is something that will be monitored closely as we move forward in collaboration with medical health officers throughout the province.
Adam, I would just add to, when policies are put forward by whomever puts those forward, and they may seem like sound policies, but there's also needs to be a certain degree of operational ability, or they need to be operable policies as we move along. And this maybe explains one of some of the mythology or some of the reasoning behind, working with these organizers, boards, organizations that are organizing these larger events, such as the Saskatchewan Rough Rider, such as organizations that are organizing concerts and things. They have the ability to actually put in a system where they can check for a proof of vaccination or proof of negative test, confirm identification of the individual, take the ticket, and move in. When you look at our retail sector, for example, and if you were to implement a vaccine, a proof of vaccination in our retail sector, this is a retail sector that has been hit very hard over the course of the last 20 months. It's a retail sector that is just now starting to recover from COVID-19. And they're, quite frankly, having challenges finding enough staff to get up to 100% operations. And so I just don't think there is room or staff available for instance, in the retail sector, for them to move forward, to have people that are checking for vaccine proof of vaccination prior to entry into the various restaurants and retail locations that we have. And so there's a number of policies that are often put forward. We have to work through as a government to ensure that those policies are actually operable on the ground and effective in doing what they set out to achieve. And most certainly what we have put forward here today, we think will start the conversation to some degree around that employer-employee relationship, and requiring for us in our front-facing healthcare employees that are taking care of our communities individuals that are in a vulnerable state often, and there are family members that are in that vulnerable state, ensuring that they are doing so as safe as possible, as well as working alongside with these organizations that are putting together these large venues who do have the operational capacity to move forward with a a proof of vaccination or proof of negative test policy.
We'll go back to Phil Tank. Phil, were you able to get your audio working?
I believe I've unmuted. Is that
great? Yeah, we can hear you. Go ahead.
Thanks. I'm wondering whether the Premier and Dr. Shahab can clarify the philosophy behind like you support organizations that implement vaccine requirements, but you don't want one province-wide. I guess given that, if you look at what the Rough Riders have announced, as well as the U of S, there is freedom of choice there. You could choose not to be vaccinated, or if you're immunocompromised, you have the option of producing a test. So I guess I think people are wondering, of course, because I'm sure you're aware that it's at odds with, what opinion poll after opinion poll have shown people want, and what's happening elsewhere in Canada.
Well, I would say that the organizations that we're working with, let's take the University of Saskatchewan, Regina, Sask Polytechnic, the Saskatchewan Rough Riders, that have all stepped forward in this space, do have the operational capacity to put this into place. They can put this in place on the ground. In the case of the Rough Riders, and we shouldn't discount the effort that this takes. They aren't able to do it by the Labor Day weekend, but are able to by September the 18th. Now, we're fortunate in the way that we have only had 11 cases of transmission at our 3 Saskatchewan Rough Riders game, and a credit to the Rough Riders organization for the efforts that they have made in crowd flow of people through the facility, availability of hand sanitizer, and all that they have done to ensure a safe environment to this point. But they are part of a broader league, the Canadian Football League, where that league and the majority of the other teams are moving towards this type of an environment where you would produce a proof of vaccination and proof of negative test. So they do and are working actively on organizing that operational ability to put this into actual practice. The same can be said about the University of Saskatchewan, the University of Regina, Saskatchewan Polytechnic. The same, I'm sure, will be true of many arms of municipal government. For example, Real in Regina, that will be putting and bidding, I'm sure, on a number of different concerts to come to town. We have organizations here in Saskatoon. We have other professional leagues that will be going. All will be looking at how do they put this capacity in place on the ground to make this operate. In fairness, there may be some that don't have that capacity, and I explained, for example, the retail sector is just now recovering from 20 long months of managing their way through this COVID from a business or an economic perspective. There's people in that sector that have lost their jobs over the course of the last 20 months. Thankfully, many of those jobs, if not all of them, are available now, and we're seeing the retail sector really struggle in finding people to fill the positions that they have. So much so that many of them are not operating even at 100% as due to the fact that they aren't able to find staff. And so the operational ability to put this in place on the ground in the retail sector is quite different than what we're seeing with those organizations that are coming forward, and those organizations ultimately that we will work quite collaboratively with to make this work. In saying that, I expect that as we get into indoor events this fall, it's my expectation that most leagues, most organizers of large events are going to be working with public health on exactly, how can we implement this type of a policy to ensure the safety and security of all of those in attendance. So it is a much more collaborative way forward than government implementing it. I firmly feel that we're going to see very similar results.
Phil, do you have a follow-up question?
Yeah, you indicated that you want frontline health workers to be vaccinated, and that it could be the first step I think that's what you suggested, is it could be the first step for, I guess, all government workers. I guess why not include all Saskatchewan Health Authority workers, since I'm sure there's interaction between the frontline people and other people in the organization.
Well, we're moving into this place to begin with. Listen, our numbers have been up, and those have been well documented over the course of the last number of days. What I watch quite closely, and I know others watch quite closely, is that our numbers of hospitalizations are also increasing. What we are doing is really venturing into this with those very same healthcare employees that we had prioritized in the early days. We're going to be reaching out to our labor organizations to collaborate with them on the path forward on this. Again, it's a collaborative approach at this point, and we most certainly want to move in this direction, and we do intend to move in this direction. But again, we want to work with those that are ultimately impacted in making this decision. It is a choice, as you said, to get vaccinated. But as we look ahead in this province to the weeks and months in the future, that is going to be increasingly challenging for those that are not vaccinated to attend large sporting events, for example. It's going to be, if they work in front-facing healthcare, likely if they choose not to be vaccinated, they're going to have to produce multiple and repetitive negative tests to ensure that at the end of the day, we are keeping those around those frontline healthcare, those front-facing healthcare workers safe, which are our family members that are in our medical institutions across the province.
We have Dan Jones with NBC.
Yeah, good afternoon, Premier. I'm just going to piggyback off Adam's question here, but your messaging has been the same for many months about just getting vaccinated. It seems that the vaccination rates have been declining, but I'm not hearing what is the major incentive you're trying to sell people on who are hesitant to get vaccinated to actually go and get it. What are you selling today that you haven't been selling for months?
It's going to be more uncomfortable to not be vaccinated in society as we look ahead. We're ensuring that we are going to work collaboratively with organizations that want to institute this proof of vaccination, proof of negative test policy. So if you want to attend a Rider game and you're not vaccinated, you're going to have to go out and get tested. If you work in front-facing healthcare and you have made the choice not to be vaccinated, you're likely going to have repeated tests in order for you to continue to arrive and work actively with people that are very ill in our healthcare centers across the province. And so, as we look ahead over the next few weeks, I said this a few times already, it's going to be increasingly more uncomfortable for you in Saskatchewan to make the choice to not be vaccinated. There's going to be events that you're not going to either be able to attend, or you're not going to be able to attend without a recent negative test. To date, we've had none of that.
Can I just make another comment, please?
Sure.
Yeah, and I just want to say that, we have to recognize also that and respect that, healthcare workers, teachers, people in retail have been working on the front lines throughout the pandemic. There were many, including healthcare workers and later on teachers, were offered vaccinations as a priority. The majority got vaccinated. But for those who remain unvaccinated in any sector, it is important to ask the questions from a healthcare provider, because the questions we are getting, I just want to share with everyone. For example, people are asking that if I got COVID in the past, do I need to get vaccinated? Absolutely. The immunity from getting COVID is not long lasting, and vaccination provides you, getting 2 doses provides you an additional level of protection that protects you against new variants and protects you for the future, because we have had reinfection with COVID, sometimes with serious consequences. Secondly, we have seen that if you're fully vaccinated, all of us will get exposed to COVID over the next months or years. COVID is not going away. Right now, it's the Delta variant. In the future, it'll be some other variant. And once you're fully vaccinated, again, we've seen that if you get exposed to COVID, you either get no symptoms, you're well protected, or you get very mild symptoms. Serious outcomes are rare. So it's much better to be exposed to COVID once you're fully vaccinated than not vaccinated, and there's lower risk of transmission to friends and family if you get exposed to COVID after getting vaccinated. So I think people, a vast majority of people who work front lines in healthcare, teaching, other human-facing services, the minority who remain unvaccinated do have questions, and I would encourage them to have that discussion with their pharmacist, their physician, their healthcare provider. Call 811, because there are great answers now for many questions. 18 months into a pandemic, and in a ninth month of the vaccination program of a very safe and effective vaccine. Thank you.
Follow-up question, Dan?
Yes, Dr. Shahab, in terms of the north, still emissions at like 65, close to 70 cases. The far northeast is at least 180 approximately. What strategy is being implemented there, possibly new, instead of going door to door, to try to increase vaccinations and at least alleviate some of the pressure up there?
Yeah, thank you. So, when we talked about what are some of the incentives and disincentives, we know that in the north, there are other challenges which include, living in crowded households, other challenges, and increase, in many populations, including, rural, northern, urban, where, many people, even in middle age, may have comorbidities like diabetes, heart disease, chronic obstructive lung disease that puts them at higher risk. So obviously, it's important, again, to use every opportunity to get vaccinated, maybe when you're in for your medical appointment or in a pharmacy to collect your prescription. Obviously, we've seen, unfortunately, that whenever there's an outbreak with, unfortunately, hospitalization and deaths, there's suddenly a surge in getting vaccinated, and SHA and our First Nation teams have been providing vaccines during those settings with higher vaccine uptake going from a low of 20-30% to higher than 80%. But again, I think our partners in the far north are continuing to work to provide vaccines to every community again and again. Those opportunities present. Some communities in the far north, they were first in line to get Moderna, if you remember, in January, February, 50 and older. And they were saying that for our younger people, 12 to 17, we would rather wait for Moderna to be authorized. So now Moderna is available for everyone 12 and older. Some communities wanted Pfizer for 12 to 17, which is now widely available. There's lots of options now, but it is in some cases, obviously convenience is much higher in larger urban settings, many pharmacies, many pop-up clinics. In rural areas, you may go to a pharmacy or book through an SHA online booking system. But again, for remote communities, I think it is going again community by community. But again, I think local leadership has been working with vaccination teams to really. And I would urge, as fall is coming, we may see a significant influenza season. We may see more respiratory illnesses. So then it's hard to figure out, is it COVID or something else? So I think this is the opportunity to take advantage of the vaccines available. Thank you.
Dan, I'd make a comment on that. And Scott Livingston, you may have a comment as well on just how the Saskatchewan Health Authority is working with the local leadership on various initiatives throughout the north. Because this is an important question, because this is an area where we do have an opportunity to push our vaccination rate up throughout our provinces north, across the province, but throughout our provinces north as well. And we've been very focused on this since the very early days of having vaccines accessible. As Dr. Shahab said, we had prioritized Moderna in the early weeks into the northern areas of Saskatchewan. In fact, as we got going with regular shipments, I believe it was 14% of our shipments that came in on a weekly basis were prioritized to Indigenous Services Canada for various Indigenous communities across the province, but also many of our northern communities in Saskatchewan. And I would just say that today we have vaccine that is available throughout the north with a selection of vaccines that are available. But maybe Scott Livingston, you might want to speak just a little bit to recent efforts and initiatives between the SHA and local leadership with respect to trying to push that availability and ultimately our vaccine uptake up in the northern areas of the province.
Thanks, Premier. And I would say to Dan, we have never stopped the multiple initiatives that we've started up in North to promote vaccines. We know that there's been hesitancy throughout, and by prioritizing Northern residents first and getting into those communities, it has been critical for those community leaders to support the program, which they're doing on an ongoing and a tenacious basis. And we know they're continuing to do that today. To Dr. Shahab's earlier point about the Moderna vaccine expanding into youth, we do know that some of those communities that had access to Moderna first have been awaiting this. So we are hoping to see a blip and are expecting to see a blip in increased vaccinations and are preparing for that. And certainly, as the Premier has already said multiple times, we have lots of vaccines and freezers across this province, lots of capability to bring that to any community. And it's just targeting those same strategies over and over again to ensure that we're getting a maximum uptake.
We have Stephanie Davis with CTV.
Hi, thank you. Just on the riders announcement today, I know there are still a lot of logistics to work out, but is there anything maybe Scott Livingston can give on the SHA, just on what fans can expect on both the proof of vaccination and the proof of negative COVID test on game days?
So I don't have anything specific to add about the strategy that the riders will be moving forward to, except for to tell you that the riders are creating a task force with the SHA to plan how exactly this program will be implemented, to not just validate vaccine status, but also offer testing at games. That will include partners across the healthcare system, including eHealth Saskatchewan and the Ministry of Health, because they both have a role to play in helping to direct. The good news is that although the riders have announced this today, there is lots of experience in the CFL with policies doing this type of work. And as the Premier has already said, providing individuals that QR code to identify them as being double vaccinated or vaccinated prior to game time will be critical, and that is being actively worked on in the province. It just won't be available for the Labor Day game, but hopefully by mid-September, everything will be put in place. And we'll have regular updates as we work through that with the riders. Of course, getting in front of the communications for all the fans and the individuals that are going to the game will be key, so that people understand how they're going to flow through the gates at Mosaic Field on game day.
I would just add to Scott's comments. If you are anticipating going to a rider game when this policy is in place, please go to your eHealth account and set your eHealth account up early. You need a PIN number to set it up. It takes a few minutes to set it up. Once it's set up, it literally takes about 2 minutes to print off or take a screen capture of your proof of vaccination data. We will be moving to a QR code in about the next month or so. But in the meantime, you may have to print off or take a screenshot of your eHealth page, which is very simple when you're in there. But the first time that you're logging into your eHealth account, you should do that sooner rather than later if you're anticipating going to a rider game when this policy is in place.
Follow-up question, Stephanie?
Yeah, thank you. Earlier today, the NDP renewed calls for the health minister to resign just after the current COVID situation. What's your response to that, Mr. Premier?
Well, I actually won't dignify that with the response. The health minister has been working very hard throughout this pandemic, and most certainly continues to work hard with Dr. Shahab, Scott Livingston, the Ministry of Health, in providing the best advice that we can to the people of the province, and to ensure that we continue to provide the services that people expect in this province. And I think this just further goes to how we see an opposition party that has essentially politicized this pandemic throughout. In the early days, they called for lockdowns sooner, to go further and for longer, and would continue to call for those up until just recently. This has been a government that has always been upfront with what our focus and what our North Star is with respect to this pandemic. It is about preserving the healthcare capacity that we have and ensuring that we can offer those healthcare services not just to those folks that have COVID, but to everyone that does require healthcare of any kind here in the province. And in addition to that, have been very focused on ensuring that when we did have access to vaccines, that we're making them available to as many people across this province in an equitable fashion. And I think most certainly we have achieved that. Now we are doubling down those efforts with, working collaboratively with our partners that are organizing large venues, us as an employer stepping into the area to, further incentivize people to make the decision to ultimately go out and get vaccinated, keep themselves safe, keep them around them safe, and ultimately, collectively, all of us together, keeping our province safe. So we'll continue to do the work of governing, and I'm sure the opposition will continue to do the work of opposing, as they have done for some time now.
And we'll take our last questions from Zach Becerra with the Star Phoenix.
Hi there, Premier. I want to ask you some more questions about this QR code that you're rolling out in the fall. You're obviously giving businesses the option of requiring vaccination to come in, but you're not enforcing it. You said you don't want to use the heavy hand of government there. I think the question that's obvious then is how enforcement is supposed to work. If I'm the owner of a small retail business and I want to require vaccination at my store, but customers refuse, how is that enforceable? Who do I call for help? And is that something that your government's going to support?
Well, let me rephrase the question. If government had put in the policy, how would government enforce that same situation? And, I'm not sure how other provinces are doing that. With respect to a business that wants to implement a vaccine policy, it won't be the government that comes out and enforces such a policy. That's a policy that an individual retail business would be putting in place. They would then need to look at how they are going to ensure that prior to people coming into the store, they're producing the proof of vaccination, the proof of the negative test. That is precisely what our Saskatchewan Rough Riders are doing now, is working through the logistics of how do you get tens of thousands of people into a stadium, ensuring that they either had a recent negative COVID test or have provided their proof of vaccination. And so, this is why it's important for a government to work collaboratively with all of those that have the operational capability. As I said, it's a good policy, but it needs to be operational on the ground. And that's why we are now working with those that are moving into this space, such as the Saskatchewan Rough Riders, University of Saskatchewan, University of Regina, and I expect there will be others in the days and weeks ahead, on how we can ensure that question is answered before it happens. That those organizations have the ability to ensure that proof of vaccination, proof of negative test is provided prior to them entering into the venue or the facility that is choosing to move forward on this. So you see the difference? It's not about policing them once someone is in there. It's about how do you have that as a requirement for entry.
Right, but doesn't that just put the onus of enforcing or requiring this policy on small business owners? In British Columbia, which is requiring this, they are putting that up into more force. Yeah. They've said that because they're requiring it from government, that business owners will be empowered to phone police if it does escalate to that situation. Not someone anyone wants, but aren't you basically just punting this down to individual businesses to have to enforce and maintain this policy? And we're talking about business smaller than
this isn't a policy of the government. This is a very different place than British Columbia, thankfully, or maybe some would think unthankfully. I say thankfully. This is Saskatchewan, where we are choosing to work collaboratively with in the two areas where we have put forward here today. We are not enacting this policy on small business owners in the retail sector. Now, in saying that, if one of them, like a large venue, wants to enact that policy, we will help them with what that might look like, given the experience of the conversations that we're having with others that are enacting this policy. But ultimately, if a small business wants to enact this policy, they are going to have to, we will provide advice, yes, but they're going to have to obviously provide the resources on how to, prevent that entry if they should so choose on their own. It's ultimately their policy and their ability. There will be no special powers given by the government for them to be policemen in their community. However, it is their business, and ultimately they can choose who would be allowed in that business or not. And people also then can choose whether or not they frequent that establishment.
Perfect. Thank you, Premier. Thank you, Dr. Shahab. Thank you, Mr. Livingstone. That concludes today's availability.